When running an MDT meeting, we would recommend having System1 open so that you can add to the patient records as you go along. And we've put together some reports that are useful when running the MDT meeting, which can act as registers and a convenient way to see all patients who need a review, as well as some other useful reports. So to get to them, just go to Reporting and Clinical Reporting. Open up the Ardens folder, and here you'll see Meetings. So for example, if you're doing a safeguarding meeting, you can open up the Safeguarding Adult or Child folders. And I can run these reports to see all patients who are on my safeguarding registers. There's also some useful reports to identify possible concerns. So for example, this one here, perform a cohabiting risk assessment on these adults as they have the toxic trio of substance misuse, mental health and violence recorded. So from there I can right click and show patients to see all patients that meet the criteria, and then I can find the cohabitants on these adults and record the appropriate risk assessment. So any patient picked up on the reports for the registers will have the normal safeguarding icon that appears underneath their name and address. So when I'm in the record, I can simply click on that icon to bring up the associated template. So on the template at the top here, I can record that I'm doing the MDT meeting. I can also type in the names of the people present. And if I'm reviewing lots of patient records, I may want to copy that text. So right click and copy, and that means I can just easily paste it into the box for the next patient that I'm reviewing. If there are no changes, I can simply tick that box. But if there are any changes, I've got everything on the template to allow me to record them. Also at the bottom of the template, I've got the cohabiting risk assessment code, and I can click on Find Cohabitants, and this will bring me up a list of all patients that I have registered that are living at the same address. So back into the meetings reports, and here I've got an end of life category. So again, I've got my end of life register that will pick up any patient that's been coded as end of life or palliative care. I have my GSF registers, and I also have some reports that help me make sure that my patient records are up to date. So for example here, consider recording a preferred place of care as the patient is end of life, and this hasn't already been recorded. So for the register, again, I can right click and show patients to see all of the patients. And then when opening the patient record, anybody that's already on the end of life or palliative care register will have this icon that appears under their name. If I click on that, it'll bring up the end of life and palliative care templates. So just like on the safeguarding template, I have my MDT review at the top. So I can tick that. I can also then just right click and paste the names into the people present box. I can record if there are no changes, and I also have all the links on the template to document any changes. I've got a link to things like future care planning, where I can add on any key messages and special notes, or a treatment escalation plan. And I also have various documents that I can print. So here I can print off a DNA CPR form, or I can print off a generic care plan, or any specific care plans too. I also have my end-of-life formulary at the bottom of the template. If I select this, I can select any starting doses. I can add the medications, and I can also print off a community drug administration chart. And finally, we also have an MDT meeting template, which you can access from Auto Consultation, Ardens General, and MDT Meeting. And here you have a useful summary of all alerts on the patient record, as well as any information that's already been recorded. And on the left of the template here, I've got access to all of the various templates that I may need during that MDT meeting.